And then around 11 o'clock, I got up to use the bathroom and my water broke while I was sitting on the toilet. And I was like, what? But it was very meconium stained. And which she was very late term, which is normal for that, right? But I just had like a moment of panic. I was like, oh no, like what if she's in distress? I was like, when's the last time I felt her move? So I just talked through it a little bit with Jeremy, and I was like, I don't know what to do right now. I called my mom, and she goes, you know what? The hospital's there for you to utilize what they have. If you want to go just to make sure the baby's okay and then come home, like that will be fine, right? Like they're there for situations like that, or they're there to just, hey, can you check on my baby? You know, most of the time they're willing to just do that for you. I was like, okay, I'll just go get her checked out and then I'll come home, you know, just to make sure. Cause I would feel so guilty if like she wasn't doing okay. And then, you know, something bad ended up happening. But I just had that moment of panic and I was like, I think I need to go have this settled so I can have peace in order to give birth to her. So we went to Eastern Maine, and my friend had a great experience there. She told her birth story here too. Her name's Natalie. She had an awesome experience doing her natural birth. So I was like, okay, maybe I'll get lucky too, like she did, and have somebody who's just super understanding and kind. So we got there. It was Memorial Day, so it was dead in the hospital. I got checked in. They took me up to the room. And, you know, right away, they're like, all right, take all your clothes off, put our gown on. We need a pee sample, all this kind of stuff. And I was like, I'll just stay in my clothes for now because I'm pretty sure I'm going to go home. And I got in the room, sat down, and the nurse hooked me up. And then she goes, okay, I'm going to have to check your cervix. And I said, well, since my water's broken, I'd prefer you not to, just because that can increase the risk of infection, right? Like logical things here. And I'm pretty early in my labor right now. Like I'm not having crazy strong contractions or anything yet. Like I know my body in labor. I know how it feels when I'm about to have a baby. And she was immediately just nasty, like belittled me, told me that, you know, she has to, she's going to. And I was like, you're not going to. I don't know what you, so it was just like probably 5 to 10 minutes of just arguing with her. It was just like just straight up arguing, like we were in middle school or something. I was like, no, you're not going to put your hand inside my body if I'm telling you no. That's called right? Like that's what it is. Even though we're in the hospital, it's still that, right? And so my husband piped up and was like, no, you're not. Leave the room, please. So she was awful.
Yeah.
So she's like, well, I'm going to go talk to the doctor. So she walks out, probably makes a phone call to the doctor telling her that I'm a non-compliant, rude patient, whatever. And so she came back in a little bit with the doctor, and the strip was looking fine. Like the baby was doing great. My contractions were consistent. Like she was having acceleration. She was doing fine. And I even told her, I said, I'm a nurse. So I kind of know what I'm talking about, you know, just to kind of have that in with her. But no, that didn't matter. She goes, oh, since you know everything. So I was like, oh man, you are not very nice. But when she came in with the doctor was like, so your water's broken. We're going to check your cervix. We're going to start you on Pitocin. And if you don't have the baby by, I think it was like 8 a.m, it was probably 4:30 at night at this point, then we're going to have to do a C-section. I was like, whoa, back it up. I came in here to get monitored for a minute and then just leave, right? So I said, well, you can go ahead and bring in the AMA papers and I'll sign them. So they brought him in, I signed him, and we left. And I feel like that was just such a confirming thing for me. Like, wow, I do not belong in a hospital. You know, I'm not going to argue my way through birth. That's not what a peaceful, undisturbed birth should look like.